Hello, welcome to another episode of Science Talks, a conversation hosted by the University of Arizona's BIO5 Institute. My name is Amy Randall Barber. High blood pressure, also known as hypertension, affects nearly half of American adults and is the leading risk factor for cardiovascular disease. Researchers are working to better understand the role of the peripheral nervous system, the part of your nervous system that lies outside your brain and spinal cord, in the development of cardiovascular as well as renal diseases. Today we are joined by Dr. Christopher Banek, BIO5 member and assistant professor in the Department of Physiology at the University of Arizona College of Medicine, Tucson. Christopher works in the nexus of cardio-renal-neural physiology and studies the causes of hypertension and polycystic kidney disease. Christopher, thank you so much for joining us today. So we just like to get started with just a couple of fun little icebreaker questions just to have fun. So if you're okay with that, I will get started. Okay.
Absolutely.
So what's your favorite snack?
Chips and salsa.
Okay.
Absolutely.
That's a good go-to. What's your go-to karaoke song? That's a tough one, right?
I want to lean towards Radiohead songs, but I'll do just the classic New York, New York by Frank Sinatra.
Okay, all right.
It's a good karaoke song.
Right? Do you have a bucket list? And if so, what are one or two items on it?
I feel like I'm young enough and naive enough to still think I'll live forever. So I haven't given much consideration to my bucket list.
Oh.
But I guess jump out of a plane at some point in my life would be nice.
Okay. I've heard
Hopefully I have a parachute.
Oh, yeah. Hopefully it's a whole thing that you've trained for and everything. You're ready for it. All right, cool. Well, thank you. So what brought you to the University of Arizona and to BIO5?
So I initially joined University of Arizona in 2019 when I was in a postdoc in Minnesota. I just really liked the Department of Physiology. It was really well-rounded. Instead of one single focus, it was multi-systems focus. Not necessarily everybody studied heart disease or GI disease. Mm-hmm. We all had our niches, which I didn't necessarily overlap with anyone, which was nice. I complemented the ongoing research, so I found it as a really great opportunity.
That's great. It sounds like you just kind of slid right in there. That's kind of nice.
Absolutely.
So how did you choose the area that you research? What drew you to it?
You know what? I kind of fell into it. I studied cardiovascular disease in my graduate work, but within pregnancy. I just really liked the research itself, the tools that we were using, the models that we were using. But then I gradually shifted to just general heart disease and cardiovascular and renal diseases, mainly because I could just see the larger impact. And I still, to this day, love the work.
Yeah, okay. Can you talk about an exciting or revealing moment that happened recently in your lab or in your research?
So what we've been previously studying is the application of this surgery to treat hypertension or high blood pressure. It has been shown to be relatively effective in hypertension, and we're trying to create a new way to apply this novel technique to potentially be a way to treat other models of cardiovascular or kidney disease. More recently, we've been showing that a model of kidney disease, polycystic kidney disease, responds really well to this neurosurgical treatment. And what it is we're simply cutting the nervous system connection between the kidney and the brain. We disrupt that signal, and we can mitigate the cystogenesis or the progression of this cystic disease. Oh, wow. So we're just seeing this novel application of this neurosurgical treatment that could have really cool benefits to this patient population that is very limited in their current treatment options. It's really just one drug that's currently on the market, that's currently FDA approved, and that was only in 2018. And unfortunately, even though that drug does mitigate the progression of the disease, their life is altered or changed drastically because they're constantly thirsty, they're constantly urinating.
Okay.
Their entire lives revolve around the bathroom at this point. And there's some liver toxicity that's also known for long-term treatment of this. So, which you can also imagine, constantly going to the bathroom can also disrupt your sleep, and that can obviously upend your life. We're trying to offer these patients an alternative, or these physicians to have some sort of other target to attack, to maybe, either have a replacement for that. That would be awesome. But maybe there's an opportunity for combinational therapy. If it's through two different mechanisms, maybe we can have a better outcome for these patients. That's what's the newest part of our lab, and that's I think
really
what's
exciting.
Really exciting, yeah.
Yeah. Oh my gosh. So one question that I have, and forgive me for my not knowing much about some of this stuff, is, if you're disrupting that pathway, are there negative effects to that?
So right now, there's not really any documented negative side effects of this renal denervation procedure. There was thought to be some complications with what's called renal artery stenosis, but that hasn't been shown to be elevated any more than what someone would develop naturally. So there's no negative side effects, other than you probably have the inability to vasoconstrict or restrict blood flow under cases of hemorrhage or blood loss.
Okay.
So as long as you're not treating patients that are professional knife fighters,
Okay, got it. Yep.
this should work pretty well for them.
Okay.
Yeah.
That's cool. That's super exciting. Holy cow. So the next question we have for you are, what are some of your research goals?
Mm-hmm.
Can you talk about why it's important you work with the peripheral nervous system. Can you tell us why it's important to understand that, and just some of the research goals of your lab?
Yeah, so we love looking at the peripheral nervous system rather than the central nervous system, i.e. the brain. It's this black box, this brain, and it's really hard to manipulate, we'll just say. It's really cool, but I favor the peripheral nervous system because I can alter that without having major side effects, we'll just say. So we can do that by either cutting specific nerve populations and to see if it can mitigate a disease progression, or there's an emerging area in the field that is electroceuticals or neuromodulation, not necessarily disrupting that nerve activity, but just modulating it, changing it, if you will, changing the signature to tell the system that this maybe pathological signal is no longer necessary or is no longer there, to potentially tell the body to kind of back off and stop whatever cycle this is that's causing the disease. So that's where the future is, I think, in this area, and that's really just, I would really love to get into that rather than just simply cutting nerves.
Yeah.
We're at the point of trying to understand the signal that we're cutting as well. So I think that'll be really beneficial to the field overall as we move forward to this neuromodulation rather than neuroablation.
Yeah. Oh my God. And I'm just thinking, like, this would apply to other things too, right?
Absolutely.
Yeah, it wouldn't be just kidney or just cardiovascular or anything. Could potentially do big things for a lot of people, a lot of diseases.
You could have it targeted too. It doesn't have to just be kidney-centric or cardiovascular or heart-centric. There's a lot of neuromodulation therapies that are developing all throughout the country that are not necessarily just renal nerves.
Yeah, okay.
Another one that's on the market right now is vagal nerve stimulation. That is, in a way, a neuromodulation procedure in which you're trying to modulate ascending and descending signal to try to mitigate disease development or reverse it in some cases, which is a really cool way to kind of just take advantage of the body's electrical system.
Yeah.
Tap into it like kind of hacking a computer.
Yeah, we need more of this.
Yeah.
We need a lot more of this. So you work at the intersection of cardiovascular and renal diseases. Can you talk more about the connection between the two, or is that really the peripheral nervous system is the connection?
Yeah, but just to kind of add to that point, a lot of people think of like high blood pressure as a heart disease. Certainly the heart is involved, but the kidney is really centric in blood volume regulation, which has a huge effect on your overall blood pressure. And so the kidney is crucial in your overall long-term regulation of blood pressure. And so that's why it's a really good target in models of hypertension. Yeah.
Awesome. Learning all kinds of new things today, huh? Your lab website says that you use telemetry-based approaches as well as acute electrophysiological preparations to evaluate the changes in nerve activity and the corresponding cardiovascular and renal responses. Can you please explain to us what that means in layman's terms?
Got it. I'm going to have to go back and maybe rephrase that just to make it a little bit clearer to everyone and not just us nerds. So the telemetry-based part of that is just that we implant a device in these animals that we can measure long-term blood pressure and nerve activity changes over time. That allows us to look at the progression of the disease over long periods of time. We're talking months. The acute electrophysiological approach that we have is much more finite, very short term. It's usually a surgical procedure that we put them under anesthesia, and that allows us to do some very careful manipulation of the neural environment to see how that affects neural activity, as well as the corresponding blood pressure and cardiovascular changes following that afferent nerve stimulation, if you will.
Okay, thank you. So this is the fun question. I looked at your lab's website and it looks like you have a fun culture in your lab. So how is like your team and your culture that you've created, how does that impact the research going on or your research experience? And please tell me more about Bash.
Well, Bash, I'll just start with Bash. He's a 4-year-old Australian Shepherd and Catahoula leopard dog mix.
Ooh.
I'd never heard of that breed until I got him. I got him during COVID. He's been a great running partner ever since. Good dog. Also lab mascot.
Yeah, that's cool.
As far as the team, I've been really lucky to have just really smart and just awesome people in my lab, all from lab manager all the way down from postdocs to graduate students to undergrads. And a really unique thing about the University of Arizona and our department, the Department of Physiology, is we have a huge undergraduate program. So I love bringing undergraduates in the lab. They're so hungry here for knowledge and just experience.
Yeah.
And so with all of that, I really love running a team-based environment. And so everyone is working together in their own capacity towards a goal together, because any success in the lab is shared. Your success is her success.
Yeah.
Her success is your success.
Team mentality, yeah.
Absolutely. So, and I just really want to get these students involved in undergraduate research to potentially, obviously and selfishly, attract them into the academic and PhD type training, because we need more of that. So just granting access alone is imperative. And I strongly believe that I have the opportunity to do that for many of these students. The other is just, a lot of these students are really geared towards a career in medicine. I want them to at least have this analytical mind or approach to troubleshooting in the clinic, and taking that research experience, I think will allow them to just be better physicians. And so
That's awesome.
At the undergraduate level, I love that. Obviously the graduate level has been great. I just graduated my first PhD student last this last Tuesday.
Oh.
So
Oh, wow.
that was a first for the lab. So it's just a really exciting time. Also a really sad time.
Yeah.
See
So
them
I was actually
leaving.
going to comment. You have an alumni section.
Yeah.
That must be that individual you're talking about.
One of them.
One of them.
Yeah.
Yes. Okay.
I actually don't think she's on the alumni yet. I haven't.
It was just Tuesday. So we'll give you time.
Yeah.
But what I wanted to share or kind of talk about is I also mentor a lot of undergrads and graduate students here, and so I understand the joy in it, and I understand the sadness when they have to graduate. And often I'm asking them, are you sure you don't want to just do a victory lap just to kind of hang around? And because they really are contributing members of the team, and we treat them as staff. I mean, they are truly part of our team. They're not just a student. So I just wanted to say I'm in love with the fact that you have an alumni section on your website. I'm thinking like we need to steal this somehow and like do this for our kids, or our students,
absolutely.
Like, they would love it. And speaking of mentoring, what is something that your mentor taught you, and what do you think as a mentor you would like to pass down to some of your students? Now realizing you have students of different levels, we can choose maybe the undergraduate in particular.
So I've had many mentors over the years.
I imagine, yeah.
And I'm very lucky to have them at the various stages of my career. Perhaps the most impactful was obviously my postdoc advisor. His name's John Osborne. He's been incredibly supportive of my career and development, and one of many obvious lessons that I've taken from him is just kind of this team-based approach is really crucial. That has been instilled in my mind throughout all of that training. And it's just really important to, I guess, think, you can get lost in the shuffle of doing the experiments, looking at data, processing it, analyzing it, and it becomes almost abstract at some point. But it's always coming back to this middle ground of just come back to this hypothesis, keep it centered around the hypothesis. Always think, how am I addressing my question? If I'm not, maybe I'm veering off into this little rabbit hole that I shouldn't be going down. So keeping it focused on the science and the underlying question is key to any research program. And so we constantly talk about this in our lab meetings and just daily discussions. How are we getting at this overall goal with this one assay? What is this telling us? So it allows the students to keep the kind of bigger picture vision as they're sitting there pipetting or taking just urine samples or something.
Things,
exactly. Seeing where that fits in the bigger picture.
Awesome. So one question we also like to ask everybody is, what is your why? What keeps you going? Why do you keep doing this type of work?
If I had to do it alone, it'd be pretty miserable.
Okay, yeah.
So the why is obviously, like I was just saying, the science and the questions, they are interesting. But the why also includes the people. I love my lab. I love the people I work with. That is certainly one of the whys. Do it for the people, do it for the science, do it for fun. It's fun to get up and answer some unknown questions. That's why we're academics in the first place.
Yeah. Awesome. So what's next for you?
What's next is we're going to dive deeper into this polycystic kidney disease. We just got an R01 funded
congratulations.
in
Yay.
December, focused directly on this question of how the nervous system, the peripheral nervous system, specifically the renal nerves, are contributing to the progression of this awful disease. So we can try to mitigate either the very early stages of it developing to try to change the trajectory of the disease, or more clinically relevant, can we treat patients that are already presenting in the clinic with PKD? Can we offer them some sort of reversal? I mean, that would be best case scenario, but even if we can delay the progression or rapid progression of these cysts in the kidney, that will buy them time, which is obviously the most valuable commodity in the clinic. And I'd be honored to give it to them.
Yeah. So what does something like that, how long does something like that take to actually, you have the idea and you've shown that it works and you can do it, but I mean, you haven't done human trials yet, right? So you'd have to, is that the process? You'd have to do human trials and
Certainly.
then be able to?
Yes.
Okay.
That is an area that I aim to further develop within our research program in my lab as well as here at the university. I would really like to see a lot more of the basic science connection into more of a translational approach in the clinic. So we're working on that right now. We have the opportunity right now to leverage this new technique that is freshly FDA approved and on the market right now for the treatment of hypertension. It's a catheter-based system. In essence, it's just a tube that you throw into a vessel of yours that can have access to your kidneys' blood vessels. And from within that blood vessel, they can perform this nerve ablation. You don't feel it. It's a day procedure.
Wow.
You're in and out real quick. And it's like a light switch. You turn it from on to off. You don't have to worry about taking a pill every morning after that, if it works.
Yeah.
That's on the market, FDA approved right now. And so that is the biggest hurdle for this area. So translating that to other patients that aren't necessarily, that have essential or primary hypertension, but may also be hypertensive, like many PKD patients are, perhaps we can use that as a kind of a shoe-in to get this, at least in the clinical trials, to see if this is indeed efficacious for people that have very, very limited options as it is. This would be a great opportunity to see if we can add to that limited list.
Yeah. Wow. Okay. Yeah, that makes complete sense to me. I appreciate you explaining that. Can you tell us what brought you kind of into or onto your path to become a PhD?
So early in my education, even as just a high schooler, I was mostly interested in writing. I love nonfiction, even to this day. I don't read much fiction. I don't have the capacity for it, really.
I'm the same way, yeah.
I always loved writing. I always loved science, but I always loved writing. And so when I went to college, I had the idea that I was just going to go into journalism or just become a writer. But I decided I didn't really like those classes. And I really found a lot of joy in my science classes. And so I just changed my path into more science-based. I ended up with a triple major. It sounds like a lot,
smokes.
but there was a lot of overlap. So it's, I don't know, there's biochemistry, cell molecular biology, and chemistry. So there's a lot of overlap there, but it just sounds fun.
It sounds like a lot, yes.
But the reason why I got into research was because of my organic chemistry professor.
One of the hardest classes to take.
I loved it though. It was fun. His name was Victor Zhadankin. And I talked to him at office hours, and we started talking about the reactions. And then he just kind of pointed to some of the stuff that he was doing in the lab. I'm like, oh my goodness, you're actually doing this reaction along with some other new things in your lab. I would love to see it. Okay. Brought me in the lab, got to meet the people, we started talking. I loved it. I just loved being on this kind of like new frontier of new knowledge.
Okay, yeah.
And so I joined his lab. I worked in it for 2 years. My first 2 publications are in organic chemistry.
Oh.
But then I made a hard left turn into physiology. It was mainly because I was walking by down the hall, I look in a room and I see them doing surgery on a little rodent, a rat, okay? And I was just fascinated. And I happened to know somebody in that room. And so I knocked on the door. I was like, can I see that? Yeah, come on in. And I've been hooked ever since. And so I joined that lab. I actually followed that person to Oregon because they started a lab at University of Oregon. And that's where I did my PhD in human physiology. focusing on hypertension in pregnancy or preeclampsia.
Yeah.
From there, I've always kind of had this just energy to just try to keep fixing a problem, which I really loved. And I really loved the research because it was focused on non-traditional treatments like exercise and timing of exercise rather than a pharmacological approach. And I think that was pretty much solidified during my PhD training, that I need to keep going down this academic route because I love answering questions. I love the research, but I also just love working with other students because the energy is just always there with young minds around. Even when I was one of the young minds, unfortunately now I'm aging, so.
I know how you feel.
But yeah, that really adds a lot of energy to the overall approach, and I haven't looked back ever since.
Yeah.
I love academia.
That's, the one constant thing that always comes up in these podcast interviews is curiosity. It's science. I mean, you have to be a curious person in order to continue on.
If you're not a curious person, I don't know how you get up in the morning and do research, because just there's no drive there.
Right, exactly, yeah. So curiosity is definitely like the foundation of your story there, and that's, thank you for sharing that with us.
Yeah.
Hopefully that also will inspire some other students who, perhaps are thinking of changing their major, and it's, that could be scary because now you've just, used 1 year of classes and whatever, and you don't want to go back, but do it, I'm telling you.
Little did I know, though. I mean, I went in thinking I was going to be a writer.
Yeah.
Turned out to be a scientist, but it comes full circle because
you have
the majority of my day is writing.
That's true.
I'm constantly writing, oftentimes pretty dry nonfiction, science articles, but there's a ton of writing involved in science, and so that was an inadvertent success, I guess, on that side. And I just want to also emphasize, I'm a product of someone giving me an opportunity during my undergraduate training. And so that has been instilled through that experience into me today. And that's why I find it so valuable for others.
You pay it forward.
And bringing them in.
Yeah, absolutely. That's phenomenal. Wish there were more people in this world like that. All right, well, that is everything that we had for you today. Cool. Thank you so much for joining us. We really appreciate learning about your work and your lab, and for you taking the time with us today. It's an absolute pleasure. And since this is audio, I feel ridiculous wearing this tux, Oh, I know, I was wondering. Not actually wearing a tux, but Thanks to our listeners for tuning in to another episode of Science Talks. Continue the conversation with us next time as we learn more about the amazing science happening at the University of Arizona's BIO5 Institute.